When Tyler was born, we decided to, get him tested for sickle cell disease because it was something we knew he was at risk of having. He was tested, it came back positive. He had the worst type of sickle cell disease there was to have and would get his crisis as early as 6 months. 2 weeks before his 6-month period, he had his first crisis, was in the hospital. At that point, we realized there's something we needed to do, and our option at that point, his doctor had recommended him to get a bone marrow transplant. It was really risky. We didn't have another child that would be a match for him, so we were looking into options of having another baby. Before we even decided what to do, I was pregnant by that February. Ethan came out, was his donor, perfect match, no disease, no trait at all. So the next step was to find a hospital that would do it, a suitable hospital. We searched around. We live in Florida, so we searched all over Florida. We actually was going through with the hospital, had everything in the works, and we halted and we decided that we needed to look for not just a hospital, but the best hospital. We need to ask around, ask a lot of different people. We did a lot of research, and his doctor actually spoke to other doctors that did transplants and things like that, and they actually recommended children. So we went to Atlanta because it meant a lot that other doctors that do transplants said, hey, go to the ones that know the most about it. It's basically what we heard. So we came. Coming to the hospital, we came in the day before his procedure was to start, the transplant. Well, not the transplant, his chemo, because he had to do that initially. He went in. We came here, the nurses, they were I can't stress enough, they were so nice to us. When we came here, we sat down, we were in the room. As parents, you're nervous. This is something big going on with your child. Anything can happen. And you sit down and you're there, and I know that I looked at my husband and we were glad we were there.
Bone marrow transplant is the only cure for sickle cell disease, and we're pleased here to provide bone marrow transplant on a regular basis to probably more kids than have been transplanted anywhere else in the country. We have a very good reputation in pediatric bone marrow transplant, particularly for sickle cell disease. We have families like the Kings who would like to come here from out of state specifically because they want to come where there's the most experience. And we're certainly happy to accept those patients and to treat them. We're fortunate also when it comes to taking care of out-of-state patients or even just out-of-the-area patients to have the support and transitional housing that those families need to stay locally. We have a new Ronald McDonald House that was specifically designed with some transplant or immune-compromised suites where families can stay after transplant for the few months typically is what's needed.
Life after the transplant, life after Ronald McDonald House, we were able to go home, well not home, but we stayed in Georgia to only come to the doctor on weekly visits. It was bittersweet, There are a lot of medications that they're on. He was on about a good 6 or 7 of them, and you have to be strict on the times. I mean, midnight, 8, those kind of things. He can't mingle. He still can't mingle with outsiders. You still have to be very careful about where you take him. He has to wear a mask on his face whenever he's out of the house, going anywhere, which is not, in essence, really hard if you look at the alternative. That's the decision, honestly, you have to make. Tyler's future, maybe he'll be the next Dr. King in the transplant floor right here at Children's.